Madam Chair, thank you. I'm probably going to have questions throughout this discussion, so you've always been very good about giving me some latitude and sort of coming in and out. But just to sort of lay the groundwork for this discussion. You know, the Senate chair said something that I think is very, very important. That this bill is intended to address threats to hospital stability. But we need, as a group, to come to terms with the fact that the biggest threat to hospital stability here in Connecticut is the fact that 1/3 of our residents are on Medicaid, and our Medicaid reimbursement rates are among the lowest in the country. And let me tell you why that is the cornerstone of our problem here when it comes to hospital affordability. All government insurance, and most particularly Medicaid, reimburse hospitals at a rate that isn't just lower than what they charge. They reimburse hospitals at a rate that is lower than what it actually costs to treat the patient. So, what is a hospital to do? The only way a hospital can cover the cost of care to those patients who are government funded, Medicare, Medicaid, where there's a deficit. Every single patient, it's not like, you know, well, we lost $10 on that patient, but we'll make it up on volume. If you're losing money on every single patient, you can't make it up on volume. So the only way the hospital can be made whole is if commercial insurers pay higher reimbursement rates to cover that gap. That's the only way the hospital can do it. Now, what does that mean? That means that in order to pay those higher reimbursement rates, those health insurers must charge higher premiums. That is where the lack of affordability emerges, because the premiums paid by employers' employees must go up. They must go up again because our Medicaid rates are so low. So, and we heard that loud and clear from the hospitals. And we hear it, quite honestly, every year. And those of us who, I'm actually fairly new to the committee, but some who've served for a long time have heard this story again and again and again. Yet, we don't do anything about it year after year after year. You know, I look at Senate Bill 3 here as a very complex, dangerous, and risky proposal to address a problem that could be much better addressed and much more simply addressed if we simply looked at our Medicaid reimbursement rates, sat down with the hospitals, and said, okay, what do you need to flourish? I'm not saying walk home with hundreds of millions of dollars in profit. Our hospitals are largely nonprofit. I'm saying, what do you need to treat patients safely and effectively and provide them the access that they need? That's the conversation that needs to be had if we are actually going to address the issue of affordability here in Connecticut. But we're not having that conversation. What we're doing in Senate Bill 3 is driving, or at least intending to drive, more and more patients to government-run and/or government-funded health insurance programs. Let's go back to where I started. The more patients in government programs with low reimbursement rates, the higher we drive up commercial premiums. So Senate Bill 3 actually exacerbates the problem that we are trying to solve. The more patients in government-funded plans and government-administered plans, the more patients in those plans, the higher premiums have to be for commercial insurance. That's the lack of affordability. That there is the affordability problem. And Senate Bill 3 just exacerbates it. I have a lot of questions, and I know they're going to come up, and always I appreciate the chair's indulgence in being able to hop in and out, but that is the groundwork around which we need to have this discussion. If we're truly going to be intellectually honest about a conversation about affordability. Thank you, Madam Chair.